tell us how you got to be diagnosed with CCCA. So this happened several years after your transplant, right? So you've been through everything. So talk to us about that.
All right. So it was a little less than a year ago, because I think it was like last October-ish or September-ish or August, maybe about a year ago.
Yep.
I contacted you and I told you I was having a lot of breakage at my knee area and itching, a lot of itching and breakage. Now, you do see some of my other family members, my mom, my sister, and my aunt all have CCCA.
Mm-hmm.
So you said to me that given my family history, you wanted me to come in for a biopsy. So I came in, and sure enough, I got me some CCCA too.
Absolutely.
The good news here, though, Achama, is that because I was plugged in with you so early on, you made my diagnosis before I really had a big problem. And so you started me on a regimen, which included steroid injections, a topical steroid, a Rogaine, doxycycline, and hair vitamins.
Mm-hmm.
Honestly, knock on wood, I feel like this is the healthiest my hair has ever been in my whole life. And I am, Dr. O, seriously bowing down.
Okay, somebody just asked about CCCA, so let's talk about that. CCCA is Centrifugal Cicatricial Alopecia. So this is the #1 inflammatory scalp disease that we see in women of African descent. It is typically described as starting in the center of the scalp. You'll usually see some level of breakage, soreness, thinning, something like that. And then over time, the hair starts to become bald, okay? Even though it's described in the center of the scalp, we do tend to see it in other areas as well. It can be patchy. The way that we manage it is by doing some of the things that you talked about. At the core of it is some level of inflammation. So in order to restore the hair shaft back to normal, you have to take away all of those inflammatory cells that are pissing off the hair follicle. And so that's why we employ some of these cortisone injections. And they're all tools. You don't have to use all of them. You can use one, you can use all. It kind of just depends on the patient. I try to be a little bit aggressive, particularly in patients who I catch early, so that we can quell the inflammation and that they can go back to a more, normal hair growth cycle. Last year, I believe in February, there was a gene that there was a study published on the gene that may be involved in this process. So, there is increasing amounts of research, and we're learning about why this thing occurs. And the really, really important aspect about this disease that I want people to know is you have to go to the dermatologist and get a diagnosis, whether that be a clinical diagnosis and preferably, a biopsy diagnosis as well. So if you notice that you have a quote unquote sensitive spot in the middle of your scalp, don't walk, run to the dermatologist, okay?
Oh, not just in the middle of the scalp, because mine was at the nape.
Exactly. Absolutely. Yes, absolutely.
Anywhere on your scalp.
Right. Somebody asked if I recommend PRP for CCCA. So let's talk about what the data shows. So there's actually not that much data for the use of PRP and CCCA, but we do use it a lot because if you have a rescuable follicle and if you have these small little tiny vellus hairs, I think PRP can work pretty well. It can work as an adjunct and as another tool to treat it. So yeah, it just depends on the particular case. And somebody said that they're wary of Rogaine because absolutely, there's a side effect to everything, right? I will tell you guys that I've been using Rogaine for the last 10 or 12 years. Because I have hair loss in the front of my scalp, and I don't think I have a mustache yet, but it can happen, right? But you have to weigh the risks and the benefits of using any particular, regimen and decide if it's right for you. And it's something that you have to talk to your dermatologist about. You don't necessarily have to start out with Rogaine, but, we want to really treat the hair follicle in total. We want to decrease the inflammation. We want to give you something to sort of rev up that hair growth cycle. We want to give you something to provide nourishment and nutrition to the hair follicle. We want to make sure that your grooming is on point. We want to make sure that your mental health is on point because we know that stress can affect the hair follicle as well. We want to make sure that you're eating properly, that, if you have any underlying, issues and problems, that those things are addressed. So Rogaine is a tool. It might not be necessarily the right tool for you, but it is a tool. All right.
Yeah. For me, Dr. O, I'm a hairy person. So I just deal with my extra hair issues, like, laser hair removal for areas on my face or whatever that, I need to take control over. So I would rather manage the excess hair problem than the bald hair problem for me.
For you. Right.
Yeah.
Exactly. So I think that that's a discussion that you just have to walk through with your dermatologist. And, we all have to be super sensitive to why people may or may not want to use a particular medication, and just kind of guide you through what the evidence bears out as far as the efficacy of various treatments. All right. And if you have scarring and it's smooth and bald, Rogaine is not really going to do anything for it. Right. So you have to have either some small follicles, or again, I call them rescuable follicles. All right. So now it's time to talk about your natural journey.
Yes. Oh my God. Thank you.
A topic that I end up talking about a lot in the office because, based on some of the things that and I say we because I've done those things to my hair as well, we have to really kind of take a look and decide whether our grooming habits are hurting us or helping us. So walk us through your journey to natural hair.
I was terrified. I did not think I knew. I came to you and said, Dr. O, what do I do? And you made some suggestions about things I could try. You made suggestions about products, styling techniques, which were very helpful. You still have to try it out, and what works for one person may not work for another person. I did rely in the beginning very heavily on natural hair bloggers and those types of tutorials, and they were incredibly helpful, but I did get into some trouble because I started doing too much.
Too mucho, yes.
Too mucho. And I wanted to be a really good natural, right? Like I would do the work, I would do the time, I didn't mind. I wanted the best for my hair, right? So I started using henna because I heard about it and henna probably works for some people, but it destroyed my hair. But again, remember, I was team too mucho.
Right.
So probably maybe overused it or what have you, but my hair it was protein overloaded. It could not get moisturized because now it's like a layer of protein on the shaft that I just couldn't get any moisture into. So it got so dry and brittle, and it started to break like the Dickens. And here I am again with thin, now natural hair.
Right.
It was
so this is, a very important statement that you're making, because your journey to natural, right? And your journey to a healthy scalp and healthy hair has to be a team effort, right? It has to be me. It has to be you. It has to be the stylist. Everybody has to stay in their lane and do a little bit of crossover, right?
I mentioned two stylists that have rocked my world. Okay.
Right. Tell us.
One is Liz at Liz Loves Hair in Bed-Stuy.
Love her. Love her.
This is her.
Yes.
Okay. And she really cares about the health of your hair. And the other is Natasha at Evolution Salon in Fort Greene.
Love
Again,
her.
Natasha is the one who did my big chop.
Mm-hmm.
It was about a year or so later that I got into all this trouble with the henna and everything. And I went back to Natasha after only having seen her once.
Mm-hmm.
And then I followed up when I started having hair problems, and she said, what happened? This is a different head of hair.
Sure.
And I had been seeing other stylists who told me I was fine, so it was really wonderful to have these two stylists on my team to really help me understand that my hair was not in a good state, that it was not healthy, that it needed to be cut again. I needed to let it go and start over. And they really helped me a lot.
That's really very, very important. You really want to get a stylist who has your scalp and your hair's best interest at heart, right? So health over style. And, there's so many great stylists in Brooklyn, Dinah in Brooklyn, you have Diane Bailey, you have Sabine's Hallway. I mean, the list goes on and on and on. There's so many great stylists, and you really want to get with somebody who also has links to a dermatologist who doesn't mind, you know, talking to them and making sure that all three of you guys are on the same page so that you don't create even more damage from a particular style. Because sometimes a stylist is like, I don't want to do this. And then the patients are like pushing it. So, you know, my job is to protect your follicles. Your job is to be cute. And we have to meet in the middle somehow, right? So, yeah.
Can I tell you about another resource? I'm actually not telling you. I'm sharing what you shared with me. Was that after I had to recut again and recover from the damage that I had done with my team Too Mucho, you told me about this, it's called the Black Pearl Magic Digital Salon.
Mm-hmm.
Changed my life, Dr. Osei Tutu. So this is a digital platform. It started and run by two natural hairstylists.
Mm-hmm.
Teach you about the science of hair and the science of products.
Right.
And how to use products as a tool to get the desired result. So my bathroom used to look like a beauty supply shop. Okay.
Right. As all of us. Yeah.
Oh, not anymore. I cleared her all out. Okay. I gave it away. And then I just focused on these quality products that these two natural hairstylists have talked about on their site. They do tutorials. The other beautiful part about this platform is that the forum users contribute to the content. So there's a lot of discourse about experiences with different products or people sharing their results and how their styles came out. So I find that incredibly useful. So I just focus on a handful of products. That's it. And this hair is 2 weeks old. I actually thought of almost 2 weeks.
That's awesome. That's awesome.
And it's just tying it at night and fluff in the morning. So my is hair that doesn't rule my life. Hair that I don't even have to think about. I can be going swimming. I can be working out. I can be going to ballet. Not that I go to ballet, but you know, living life and not having my hair be driving how I spend my free time. It's crazy.
Absolutely. Okay, good. So let's talk a little bit about your lifestyle, diet, exercise, things like that, and how you feel that that's helped you, and, you know, talk about that.
You know, Dr. O, I think it's almost like a chicken and egg thing.
Sure. Because
my hair has now not become the center of my universe. I actually have time to do those other things.
I'm going to just turn on my light. You keep talking. Go ahead. Mm-hmm.
Okay. And those other things contribute to the health of my hair, right? So I work out maybe 4 to 5 times a week. I spin quite a bit. And sometimes I even feel like my hair is better. You know, it feels, you know, a little bit moisturized, maybe because it got a little sweaty or whatever from working out. You know, I swim. Well, I haven't been swimming now since Corona, except I did go swimming on the 4th of July, but I had gone to out of town. So I work out 4 to 5 times a week. I have a pretty clean diet. I changed that a few years ago. So I'm not vegan, but I do have a more plant-based diet. I do take my hair vitamins that, you know, is part of my treatment regimen with you quite religiously. I do have a meditation practice. So it's actually all these things that, you know, like I said, chicken and egg, because I now have more time, I can do these things, which then impacts my overall wellness, which of course impacts my hair.
Okay, good. So thank you. I think that, you know, your story is at least pieces of it I hear on a pretty regular basis. And so I thought you were kind of the perfect person to articulate some of the things that I see in the office all the time. Thank you so much for being brave enough to kind of tell your story, because, you know, hair loss is embarrassing, right? For many of us, because our hair is our beauty, right? And so we often tend to hide it. And I think it's really important for us to start to talk about it so that we can get answers, and we can start to get treatments to some of these issues that we're having. So
I'll tell you that I hid it, right? Like I used to wear my hair in a way that would mask my my thin edges. It wasn't until I actually got to the other side of it that now anytime I see somebody who has a problem, or friends who know that I had this problem will tell other people, and I'll be like, look at my before photos. Here's Dr. O's website. You have to go see her, because
Right.
it has been so life-changing for me.
So somebody's asking about hair vitamins. So I think vitamins tend to be a pretty personal choice, right? So we have to make sure that internally you have no other specific issues, right? So if you have a thyroid problem or an iron issue or some other vitamin deficiency, we want to make sure that we take care of those things. But in general, the two that I recommend in the office are Viviscal Professional and Nutrafol. So, and she's used both of them in the past, and I think that they both, I use them for different indications, but I think that they're both pretty good.
Yeah,
Okay.
yeah. I both, and I like, yeah.
Somebody asked before about Rogaine for men versus Rogaine for women. Most of it is a marketing ploy. You just need to get Rogaine or minoxidil 5%. That's where kind of it works its best, whether it's in a pink box or a blue box. It's just minoxidil 5%. And for women, you just need to use it once a day.
Just look at the prices, because I think sometimes the things marketed to women tend to cost a little more. So I've always just bought the Rogaine for men, and I buy them in a 3-pack, and I think it's a little cheaper on Amazon. I'm not pushing Amazon, but you know, buy it where you want. But I tend to buy it in 3s, and I tend to order mine on Amazon.